Hello, everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. I'm going to continue my series where I'm speaking about low back pain and activities or sports that cause low back pain. I've already done an episode on low back pain in weightlifting, low back pain in running, low back pain in cycling, and golf. Well, today I'm going to go over racket sports. Racket sports are enjoyed worldwide. There are millions of people that participate in racket sports, and there are a large number of racket sports. Now, the thing that is common in all of those sports is that there is asymmetrical motion, meaning that most of the time the same side is being used over and over again when the racket is being swung. So therefore, there is asymmetrical development and asymmetrical use of the muscles. These muscles get stronger on one side and they get fatigued on that same side also. So there is development that is uneven. Now also there is a large number of starting and stopping involved in racket sports. You start really quick, it's a burst motion moving in one direction, and then all of a sudden that motion is stopped suddenly. So therefore there is a great deal of starting and stopping in racket sports. And also there is a large amount of rotation, meaning that the athlete is constantly turning in one direction all the time. And that's also what I mentioned before, is that it's asymmetrical, meaning that this rotation is asymmetrical. When we speak about tennis, think about the serve. The athlete bends backwards very far. Bending backwards is called extension. That is moving the spine backwards. This is what's called hyperextension when they are bending very far backwards. And this happens every time the athlete serves the ball. So therefore, they are setting themselves up for low back pain. When we think about the different things that I mentioned that occur in racket sports, first of all, I spoke about the tennis serve, where there is a large amount of extension in the lumbar spine. And then we speak about it being asymmetrical, a large amount of rotation, and a large amount of starting and stopping. These four things contribute to low back pain in racket sports. One factor that is very important in preventing low back pain in racket sports is to strengthen and condition the lower extremities. This is where the starting and stopping comes into play. Starting and stopping puts a great deal of stress on the lower extremity. We're talking every part of the lower extremity, from the feet to the ankle, the calves, the knees, the thighs, the hips, and the pelvis. So we want to keep all of those areas as healthy as possible. You want to train both sides equally. Make sure that there is bilateral strength. Just because the sport is asymmetrical doesn't mean that the training should be asymmetrical. So you want to train the lower extremities and keep that area as healthy as possible. You can do foot strengthening exercises, ankle strengthening exercises, shin and calf strengthening exercises, knee joint strengthening exercises, thigh, hip, and pelvis strengthening exercise. So you want to keep the entire lower extremity as strong as possible and as flexible as possible. This is going to help to prevent fatigue, which can lead to injuries. The sudden starting and stopping is something that it's part of the sport. It's not going to go away. So conditioning the lower extremity is very important in lessening low back pain, because when the lower extremity becomes injured or becomes fatigued, a larger amount of stress is placed on the lumbar spine. So therefore, we want to keep the stresses where they belong. So you want to condition the lower extremity so that the greater demand is not placed on the lumbar spine, therefore contributing to low back pain. So keep the lower extremities as healthy and as strong as possible. Another factor in preventing and rehabilitating low back pain from racket sports is strengthening the deeper core muscles, strengthening the diaphragm, the Multifidei muscles, and the Transverse Abdominis muscles. The diaphragm is the primary breathing muscle. This can be strengthened by performing normal breathing exercises. First, you can check and see if you are breathing properly, and then if you are breathing properly, you can use the normal breathing exercise to help to strengthen the diaphragm. The next muscle that I mentioned is the multifidi. The multifidi muscles are the deep muscles of the spine. When contracted bilaterally, meaning right and left side at the same time, they extend the spine. These are smaller muscles that are deep in the spine. They connect one vertebrae to the next. And when contracted bilaterally, they extend the spine. So you want to perform exercises that are going to strengthen these muscles. If the multifidi muscles are not strong, then the larger, more superficial muscles, such as the paraspinal muscles, have to work harder to stabilize the spine. And that causes those muscles to fatigue and can set those muscles up for injury. So you want to perform exercises such as the football lumbar spine extension to strengthen the multifidi muscles. And the last muscle that I mentioned for the deep core is the transverse abdominis. The transverse abdominis is the deepest of the abdominal muscles. It wraps around the spine, acting as an anatomical weight belt. These muscles are extremely important. You want to make sure that they are as strong as possible. You can strengthen the transverse abdominis muscles by performing the abdominal drawing in maneuver and abdominal hollowing. Abdominal hollowing is also known as stomach vacuums. So these three muscles are very important to keep strong. Again, you want to strengthen the diaphragm, you want to strengthen the multifidi muscles, and you want to strengthen the transverse abdominis muscles. Two other key factors in preventing and rehabilitating low back pain from racket sports is to build bilateral strength. Like I spoke about before, these sports are asymmetrical sports. So you want to build strength on both sides. Therefore, it's going to prevent a muscle strength imbalance from occurring. Many times, muscle strength imbalances are one of the main contributing factors to any type of musculoskeletal condition, especially when we speak about sports that are asymmetrical. So you want to build bilateral strength. Once you have performed the exercises I just spoke about that strengthen the deeper core, then you could start to perform other exercises that are going to strengthen the entire core. More functional exercises. You could perform abdominal bracing, you could perform the dead bug exercise, and you could perform planks. You can use a Bosu ball to perform planks. You can use a wide variety of exercises to help to strengthen the core muscles and build bilateral strength. Now, another factor is to work in the transverse plane. The transverse plane is a rotation. So you want to perform strengthening exercises that build strength in the transverse plane. These are twisting, basically rotation exercises. That is going to help to strengthen the muscles in both directions. Just because the sport is asymmetrical doesn't mean that you just train going in that direction. You want to build balance strength while you are moving in the transverse plane. So perform rotational strengthening exercises in both directions. Low back pain can be debilitating and it can prevent you from training and participating in competitions. So you want to make sure that you do everything you can to prevent low back pain, and if you get low back pain, you want to do everything you can to rehabilitate low back pain. Now it is time for the disclaimer. Yes, the famous disclaimer. Viewing this video does not take the place of seeing a medical professional. If you are starting to get low back pain, see a medical professional. You can see a doctor of chiropractic like myself, or you can see another type of doctor. Seeing a medical professional is essential in getting the proper diagnosis and setting you on a path of recovery. So please see a medical professional if you start to feel any type of symptoms in the lumbar spine or any place else. Never perform an exercise that elicits or intensifies symptoms. If you start to feel an elicitation or an intensification of symptoms while performing an exercise, please stop immediately and find a viable substitute. Always work through a symptom-free range of motion when you are performing an exercise. Even if that range of motion is very small, you still want to work through a symptom-free range of motion. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report, where I went over low back pain in racket sports. I greatly appreciate you viewing. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can find additional information on the book, and you can also find my blog. My blog contains articles on spine health, sports medicine, chiropractic care, exercise, fitness, and nutrition. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Also, please feel free to subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Thank you again for watching. I greatly appreciate it. And please remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Prevent injuries, rehabilitate your injuries, and accomplish your goals.